We're all appreciative. Oh, thank you. Welcome to Senate Economic Development, Housing and General Affairs. It is Thursday, May 29th, and we are discussing our concurrence or not to S-122 as it's come back from the House. And we have some time pressures. So we are looking at specifically at sections 8, 9, and 10, which address some additional requests from the Treasurer's Office on our baby bonds program, which we set up last year and is in statute, designed to break cycles of poverty. And Abby Duke is the reporter of the bill. And so Abby, we turn to you.
Great. So these sections,
introduce yourself.
Oh, thank you. Representative Abby Duke from Burlington and from the House Commerce and Economic Development Committee. So sections 8, 9, and 10 basically create some new language associated with allowing the state treasurer to do a 5-year baby bonds pilot program.
Right.
So I think it's section 9. So it basically there are national funders interested in helping states start these programs, and this language basically aligns this to allow the state treasurer to raise private money to implement a time-bound and also a time-bound program to evaluate the success of the baby bonds program. So the idea is they would engage with partners and create an advisor, and there's language in here like number 8 about establishing an advisory committee, identifying research and evaluation partners, and evaluating the criteria so that it's a true pilot program that can be evaluated at a research level in terms of the effectiveness of the baby bonds program.
But not yet implemented.
But not yet implemented.
Designed, right. But not yet implemented. So
it would be designed, and then section 9 says, okay, you can create a special fund, you can raise money to pay for the administrative costs and the costs of running the program. So the idea is, let's say you have a cohort of rural students that meet a certain income eligibility, let's say they're on Medicaid, and they receive when they're, again, I'm making these numbers up, when they're 15 years old, they are said, okay, when you hit 18, you are going to have access to this money, $10,000, whatever is determined to be the amount that they would have gotten if there had been a baby bond program when they were born. And then there would be, the program would include, as if they were getting the baby bond, but okay, then you can use it for these certain uses, then the program would follow them now that they had access to the $10,000, $12,000 to use for approved sources, approved uses, education, starting a business, buying a home, wealth building activities. So this pilot program would fund it and then fund these students and then for young people and then track the benefit. And they would have a control group as well of folks who did not have access to this hopefully wealth building activity. So and then in this language at the end of the 5 years, there would be every year the treasurer would be reporting back to us saying, this is how it's going, this is what's happening. At the end of 5 years would be a final report. And then the actual baby bonds program could start with both it is needed to both have the report of how this pilot program worked, the effectiveness of it, and the funding of the baby bond trust.
But if it's not implemented, they won't have a report on how it's worked. What they'll have a report on is how they've designed it and what the final design looks like. And
that's right.
But this enables them to raise money. There are some international funders who are interested in supporting this work.
That's right.
It does nothing to appropriate any state money.
That's correct.
And it just continues to enable a program we set in statute last year.
Correct. So it would say we set up the statute last year, but we did not fund it.
Right.
This enables the treasurer to run a rigorous pilot program to do the research with no state appropriated funding. It would all be privately raised money to implement the pilot program. And at the end of 5 years, there would be a report showing the effectiveness or not of the program. Okay, so what were the results of this program?
Well, we won't have results until we actually implement it. So I think that's, well, you can't talk about that, but you can certainly say that in that time we will have a design that they have sort of tested and seen if that that would work
Right.
when implemented, which in 31, they will be asking us to both fund and implement, I
Right,
believe.
so in 31, they would have they would have limited data of what they had been able to design and do so far.
Right.
Correct.
So, before we take questions, Becky, I'd love to have you weigh in, because we have to go to a conference committee in 8 minutes. So I would love to get us to the point where we could come back. If necessary, we can come back a little later. We're on the floor at 3, but we're needing to take action on this today. So if you'd be kind enough to fill us in, we have some concerns that have been raised, which you may have heard yesterday. So tell us why you need this.
Becky Wasserman, Office of the State Treasurer. So as was stated last year, the legislature authorized our office, authorized a permanent baby bonds program, but did not fund it. And in statute, you also authorized us to do this pilot program upon notification that we received funding. And the pilot program was tied to the trust account that was established for the permanent program. As we have started to work on the pilot program, we've made a good amount of headway in creating an advisory committee, working with, as was mentioned, national other pilot programs around the country and other organizations that work on baby bonds pilots. We have been told by our operations folks that the way that the sort of permanent program trust fund, it was created in statute, would not allow us to accept funding. So our main ask here was to create a special fund, not for state funds, but so that we could accept the funds to support the pilot program that we are already authorized to do in statute. So it's not authorizing us to do anything different in terms of the pilot program. It is allowing us to accept that funding. We also see the pilot, as was mentioned, as an opportunity to collect data and evaluate the effectiveness of a baby bonds program. And so right now in statute, there's actually no reporting requirements to the legislature on if we do a pilot. We were authorized to do a pilot, but there's actually no report back to the legislature to let you all know what we find. So this language is also requiring us to do annual reporting requirements to the legislature over each year of the pilot, and then a final report to the legislature, which will then trigger, the decision of whether to do a permanent program. So we thought it would, we were actually giving ourselves more responsibility so that we could give you the information you all need to determine whether you want to fund this program permanently. So that's really the motivation for wanting this language. So it's the sort of trickiness that we have right now for we're not able to accept funding the way it was drafted in statute. And that is more of a finance and management issue, just about like an accounting issue. And then the other is that we are hoping just to give you more information about how we're designing our program and the data that we're collecting.
Great. So we have I know we have a couple members who have some concerns, and now is the moment for us to address your concerns.
Well, I think I've certainly expressed my concerns.
Yeah, but they have them.
Right. I know Becky has certainly. I do have some concerns about the program. I think it may be a great program for a private charitable institution or nonprofit to undertake for its own purposes. I question whether or not it's a program that is basically discriminatory, that's being instituted on behalf of some people who perceive at this point to have need, but may not have need next year or the year after or the year after. And it, in effect, takes away, in theory, money and opportunity for people who may, by the time they reach their 17th or 18th birthday, in fact, have that need. And that's just my concern. And I expressed it, I think, before we voted last year on this particular measure.
And David, you
sure, there's a couple questions. First, if if awards are made at birth, do we need 18 years to see empirical results?
That's the maturity period.
That's.
Right,
So
and-
that's a significant amount of money.
Becky, why don't you answer that?
Yeah, so that is how the sort of a permanent baby bonds program would work. We are doing what we're designing the pilot as an accelerated program, which is what many other pilot programs across the country are doing to see the effects of the baby bonds, but choosing a cohort that is either a middle school or close.
What age then are the awards given?
The awards are given at birth, right? Becky?
That's how the permanent program would work. But in order to do a pilot in 5 years, we would have to be giving students who are maybe somewhere between the ages of 12 and 15 the funding that they when they turn 18, so that we can see the results. So that's the point of the pilot, is to have more of an accelerated 5-year period to
Thank
see
you.
data.
That's helpful, because that was not clear.
So second question is the Treasurer's Office involved in the 529 program?
That's run out of VSAC. That is not a program run from our office.
Association with treasurers.
No.
And was there ever a concept to utilize the 529 program as opposed to setting up a separate baby bond program?
I mean, a 529 is, I think, just a separate tool. I will say that we have VSAC members on the a member on the board of our baby bonds advisory committee, and I think having that connection is very helpful. But in terms of sort of like a child trust account that is just specifically for education, that's different than baby bonds, which can be used for other wealth building activities. So education is one of them, but it's not all of the options that you can use the funding for.
Leads me to my third final question. So based on other programs, baby bond programs, is a generic bond the best way to break the cycle of poverty? And how is this maybe counterweighted with the other option, which we were just talking about, the 529 or education programs? Is a generic bond the best way to break the cycle of poverty?
So they use the term bond. It's not actually a bond. It's that's just what the name has been called, but it is an amount of money. So we're targeting somewhere around $20,000 is what we would think that an investment, if we had invested $3,200, which is in statute at birth, we think it would grow to around $20,000. That is what the state of Connecticut has in statute as well. So it's really just a funding amount of $20,000. It's not a bond. And there's research that indicates that having just a college or an education is not necessarily going to break the cycle of poverty. It could be an option, but there's other there's the reasons that the 4 categories are chosen is based on is evidence based on areas that do help people with wealth building activities.
So to answer your question, I think this is a little broader than the 529 plan, which is just for education, I believe. This enables people to start a business, to apply it to education or to an apprenticeship program or to a certificate program of some variety. It also enables them to buy a house.
By property, right?
Yeah, and what's the fourth?
Retirement.
And invest in retirement. Okay, we've been given reprise until 11:40, so Randy.
I want to just think about that last for a second and then perhaps come back to me.
I have two
Okay.
questions.
Yeah.
So I heard you say, Becky, but Mrs. Wasserman, that you already have baby bonds pilot in statute, that you can do that. But the language I'm looking at that was added to S-122, Section 8 is entirely new language enabling a baby bonds pilot program. Could you reconcile that for me?
Sure. So what is in statute? It says, it's currently 3 VSA 609. It says the treasurer is authorized to administer, to receive donations and issue a publication that official statement that they received donations to implement the trust to operate a pilot program. There is the pilot program. It shall be used to evaluate the impact, effectiveness, and operational necessities of a permanent program. There is no other information in statute sort of giving us any reporting requirements to the legislature. There's no other sort of guidelines for how we would design a program. And the pilot that is here is tying it specifically to the permanent trust program. And so we wanted to both put a pilot in session law because it is not a permanent program. It's time limited. We want to do a 5-year program. We also wanted, in order to meet the requirements that's currently in statute about evaluating the effectiveness of the pilot, we want to be able to come back to you and be sort of transparent about the data, about how the program is designed, how the data we're receiving is proving the effectiveness of the program. So we're really trying to sort of give ourselves more reporting requirements to implement a program. I mean, I think right now we could implement this and not have to give any information to you all, but I don't think that's really serves the public good.
It won't help us. It won't help us design a permanent program.
My second question. So I have major reservations about this, and I don't think we should design a permanent program for this because I'm just really worried about taking on this responsibility of tracking eligibility both at birth throughout the 18 years and then when they turn 18. I'd rather see us use our state apparatus to assist kids directly while they're in poverty throughout their life rather than standing up another platform or system that would effectively delay that impact for them. But my question is, I do support Vermont Saves. I think that's great work. I think you're doing great with medical debt. I like what you were doing with the landlord, trying to give those people a leg up to be able to improve their credit reporting. But all of those require administrative overhead and oversight. And I remember that was a big concern for you with the landlord lift up program that you're talking about. Do you really see this as being something that's manageable within our limited amount of administrative resources, as opposed to looking for ways to enable things like VSAC or other entities that are doing this type of thing, serving in this role? It just seems like it would be a huge administrative lift for both current and future treasurer's office to maintain this program.
So I think part of the reason of doing a pilot is to evaluate what that administrative burden would be and the effectiveness of the program. I will add that our baby bonds program design, as we envision it, as well as other baby bonds programs, envision having, if you were to start it at birth, and this is how Connecticut is implementing this, is envisioning having wraparound services for those families and children that start at birth. So I actually see this as a way of getting the children that are eligible to be recipients of baby bonds more services and connecting them with more services that are available to them starting at birth. And there is data that shows that, having that sort of interaction, having that knowledge that you will be receiving this funding does, could change behavioral outcomes for families and children. So I think I see this as actually a way of sort of an intervention from a young age for children, rather than just this idea that they're getting money when they're older. And yes, you could do something through VSAC, through 529s. That's just a different plan, and it's just focused on education. So I think there's also a reality that not every child or young adult will choose to pursue higher education or technical education. So I think this is giving people opportunities. I also see it as a retention mechanism for Vermont, because we are encouraging people to start businesses here, buy property here. So, I think there's a lot of actual policy goals associated with baby bonds that would be really healthy for the state economy.
And in terms of administrating, I just want to put in perspective The treasurer's office administers all the pensions. I mean, you administer hundreds of thousands of Vermonters' financial situation through the pension program, through the retirement program. I am not worried about their ability to administer this. I guess one question I think we should, as we create that, look at this in context, how many kids are we anticipating a year for this? Because as I recall, it's not that many.
Yes. So, well, I mean, for the pilot, we're aiming for somewhere around 200 kids that would be in it just for that 5-year period. And then I believe it was around 3,000 babies are born on Medicaid a year in Vermont. So that would be what, if we had a permanent program, that would be what we're talking about. And then in terms of administration, I will add, we part of the administrative costs that we will be fundraising for is to contract with a third-party vendor who serves as a program administrator for other baby bonds pilots, and that is how we would likely be administering our program as well. Our pilot program, sorry.
Okay, Randy, did you think what's your?
Well, I got a couple of things. First, you mentioned 20,000 is the end result that you're looking for as the end in terms of value. Is that 20,000 in today's dollars, or is that $20,000 inflation adjusted?
So I'm just talking about the pilot program. So that is today's dollars, because that is what we're envisioning for in the next 5 years, in the next 2 years or so, we'd be giving that money to recipients of the pilot program. That is different than obviously if you had a inflation over time, 18-year program, but the 20,000 is what our estimate is right in today's dollars for the pilot.
Well, does that say in the pilot that you're going to, in effect, invest $20,000?
No, they're investing 3,200 in each child that's born in Vermont.
3,200.
That is if we had done this. We are estimating, like, if we had done this, our estimates if we, let's say, do 3,200 now or whenever we started the program in 18 years, that would be around $20,000. So that is the amount that we are targeting for the pilot, because that is, that is what would have happened if we had funded a long-term program. That is the same amount that Connecticut has also used for their long-term program. They have a long-term 18-year baby bonds program.
And remind us when they made that permanent.
It was passed as a permanent program. They didn't do a pilot in Connecticut. That I think was 2 years ago it passed.
Okay, so they've just done it.
More or less identical to what we are envisioning here?
Yes.
Yeah, but they made it permanent right away. Okay, great. I don't know where Keisha is.
Second question.
Yeah.
You had mentioned that we have about 3,000 children born per year under Medicaid. How many total children are born in Vermont? Do you know? What percentage that 3,000 represents of the total newborn population?
I don't know. I don't know the answer to that. No.
Okay.
Google says
I
5,000.
know by county we have estimates by
5,000.
county.
I'm sorry, Becky. Google says 5,065 live births in 2023 in Vermont.
Yeah, so I know by county, the Medicaid births, in some counties it's around 60% Medicaid births, and in others it's more like a 40%. But that sounds right, that averages about 5,000 a year.
And I would hope as a result of this program, we'd have fewer children that were born in that kind of need, because I would hope that we would have had many more people who really benefited and successfully cycled off of needing our assistance fully.
And in the Connecticut program, are they doing the same thing, basically using a Medicaid base to determine who is a beneficiary?
Yes. Rhode Island, I'm not sure where it is, and their legislature is considering this right now, and I believe they use a different measure, which I think is the TANF, babies on TANF. So, but we are using. So I think there's other ways you can think about it, but Connecticut is Medicaid.
Thank you.
Okay, so, I don't know where Keisha is, and, I've asked her to come back. So this is this.
Can
Yeah.
I share the
now-
House's, our committee's perspective?
Yes.
So our thinking was that this is a way to really evaluate the program without any state dollars, and that down the road, there would be the question about whether or not
Right.
it becomes a permanent program, right? So whether or not there would, and there's all sorts of questions about, you know, and looking at the policy objectives of this program, and so.
But at this point, during the evaluation period, are funds being solicited from nonprofits in order to?
So that special fund, they would be able to solicit funds to implement the pilot program. That's right. So
The pilot program.
That's right.
Right.
So they'd be
What
able
happens
to-
if the pilot is unsuccessful or doesn't go forward or plug gets pulled at year 3 or whatever? What happens to the money in the special fund then? Does it go back to the recipient?
Becky, do you have
donor,
a vision for that? And then I'm gonna call the question on this because we have to get up to conference committee.
So if we accept grant funds, we would have to comply with the any restrictions and conditions in a grant agreement. So that would be specific to whichever foundation provided us the funding for that.
We don't have.
I mean, we would not keep money in the treasurer's office for a pilot that folded.
It would be something you'd have to work out in what you do, in other words, but at the same time, you're collecting money now.
In order to run a pilot program, we need to raise money in the way you would raise money for any, from any foundation or grant application. Yes.
Okay, thank you. Thank you, Becky. Thank you, Abby. Committee. I believe we have 2 options in front of us. One is concur with 122 as it's come over. And where are you on that? And the other option is to pull these sections and continue to work on them next year. I think there are 2 of us who are very strongly supportive of this project and believe in it strongly. I'm sorry that 2 of you haven't benefited from the incredibly compelling testimony we had last year, at least compelling for some of us. And so I am happy for us to continue this work so that we can see the results in 5 years of whether we want to invest in this as a permanent program.
If I could just add, I mean, I think the question now is, are we going to go through more work to take this out when we'd then be leaving private dollars on the table that could otherwise go to Vermont kids and families? That's the question I see before us, and get more of your questions
I see
answered.
the question, definitely. I see the question is, do we leave this in the philanthropic community or do we?
This is in the philanthropic community.
This is not. This is state government. Or do we allow the philanthropic community to continue with this type of initiative, or do we absorb it into the state?
Or do we decide that we need more information to craft something that
That's
does
what,
not have the issues that we're concerned about and that we may hold it over until
and we will have that data in 5 years if we say yes to this.
we may or may not. I'm not convinced we'll have this data
Well,
at all.
I think there's, Becky?
Oh, I just want to add, we do have authority right now to do a pilot. So this,
Mhm.
I don't know that the question is that we would not do it. We would still do this. I think it's,
But you wouldn't have the funding.
I don't know how we would figure out how to get the funding, but I mean, we have authority to do it. We would not be reporting back to you necessarily in the way we have created the language right now to give you the information that you would need for a permanent program.
Would you be able to solicit funds from charitable institutions without our taking action right now?
I mean, we would have to figure out some creative way to do something. I don't know, we have not explored that because the idea of having a special fund is really the way that would
To do
make
this.
To
this.
do this transparently.
And to
Yeah.
do it yeah. So, we need to go. I would like very much for us to, have a motion to, one way or the other, but I would like.
I move that we, did you say adjourn? That we concur with the House proposal of amendment to S-122 favorably, move favorably.
And I don't have a vote sheet for you. I apologize.
Yeah, it's a
Oh, that's right,
concurrence,
it's a straw
yeah.
poll. So, all those in favor at the moment? And all those opposed? Okay, so
I don't support this program, and I'm just worried that it's gonna continue down a path that the state government's gonna take this on. I expressed these concerns during the campaign when people asked me about it. I just don't see the baby bonds as something that Vermont state government should do, and I don't think it directs the dollars to kids in poverty now. It's delayed for 18 years, and there's a lot of oversight between when the baby's born and where they're living and where they are at that age of 18. So I'm sorry that this seems to be a surprise, but I communicated this when the treasurer was here at the beginning of the session, and I also in private conversations with him, so I
I've
don't
done the
support
same.
advancing this.
And you know, I was not enthusiastic about this last year when it was in this committee. I expressed many of those same concerns.
I just stand by that we are now leaving private dollars on the table that could otherwise go to Vermont kids to see if this adds
I
benefit.
think what we can do, is
That's-
we can craft a
I have to
program
know.
that solicits
we have.
money
Thank
from
you for
private
joining.
donors to accomplish this purpose and a wider.
We're
purpose.
late to our conference committee.
And that would be what I would propose to do. And I'm happy to support something like that. Thank you.
Thank you. Thank you, everybody. I don't know how to go off live, but.
I'll do it.
It's all heartstrings.
I don't think so. I actually think this is an effective opportunity.
There's no question there's some benefit there.